So as we know, the overdose epidemic is a major public health challenge, and stimulant-related overdoses are rising at a disturbing rate. So it's absolutely vital that leaders of our states and territories prioritize a public health and public safety response to stimulants and polysubstance use. I'm so glad you're going to be working together and with NGA over the next year to build and strengthen your plans for doing so. Today, I want to talk about what the Biden-Harris administration is doing to address stimulant use and overdoses through evidence-based strategies, and the vital role territories and states play in protecting public health and public safety. As you know, we're facing record high overdose deaths, mostly involving illicit fentanyl and related substances, and often involving multiple substances like cocaine or methamphetamine. Overdose deaths involving psychostimulants more than quadrupled from 2013 to 2019, and more than 26% of the overdose deaths in 2020 involved a psychostimulant. Now, polysubstance use is not new. There's a growing problem given the prevalence of and lethality, however, of illicitly manufactured fentanyl that's prevalent in our drug supply. So to bend the curve in overdose deaths, we have to rely on evidence and data to guide our response. It's critical that we understand which populations are at greatest risk and tailor our response to meet their needs. For instance, we know that people without insurance and who make less than $50,000 a year are at elevated risk to use methamphetamine. We also see higher rates of use among gay men and bisexual men and women. Additionally, rates of drug overdose deaths involving psychostimulants are about 1.4 times higher in rural counties than in urban counties. And there are disturbingly high rates of methamphetamine use among Alaska Native and American Indian communities. One study found that roughly 26 out of every 1,000 Alaska Native American Indian individuals use methamphetamine, compared to fewer than 7 out of every 1,000 in the general US population. As for cocaine, use is highest among people with some college education and people who are unemployed, with the highest prevalence among men, Alaska Native, American Indian, and Native Hawaiian or other Pacific Islander populations. So knowing the at-risk populations creates an opportunity for us to develop targeted interventions and address culturally competent care in our approach to reducing stimulant and polysubstance use. Trends in substance use evolve, and so too must our policy responses. So preventing overdoses and substance use disorders generally rely upon a holistic approach, and one that reduces the risks that can lead to substance misuse, while also meeting the needs of the 20 million Americans with a substance use disorder, and making sure we support the estimated 23 million people who are in recovery. The Biden-Harris administration's public health approach to the issue spans the continuum of care, from evidence-based prevention to harm reduction, treatment, and recovery services. This includes efforts to improve equity in drug policy and healthcare, ensuring that our addiction workforce reflects the community and offer evidence-based care across the country. President Biden has made it clear that addressing the overdose epidemic and substance use disorder is an urgent priority. So in April of this year, the Office of National Drug Control Policy released the administration's first-year drug policy priorities. These priorities focus on building a stronger, evidence-based infrastructure to meet these needs. Already this year, the Biden-Harris administration has delivered almost $4 billion through the American Rescue Plan for mental health and behavioral health issues. This includes nearly $30 million specifically for harm reduction. And most of this money has already gone out to states and territories and other jurisdictions. Also, since the beginning of the year, we've removed unnecessary barriers for prescribing buprenorphine to 30 or fewer patients. It makes it easier for physicians and other medical practitioners to treat patients with opioid use disorder with the standard of care. We've also allowed for federal funds to be used for fentanyl test strips, which are a key harm reduction tool. And designated 6 new counties as part of our high-intensity drug trafficking areas program, and funded the nationwide expansion of the HIDTA overdose response strategy. It's now in all 50 states Puerto Rico, the U.S. Virgin Islands, and the District of Columbia, and provided funding to develop model legislation for states. This effort will provide model legislation so states can pass laws that remove barriers to harm reduction services, as well as promote equity and access to treatment, and include drug enforcement efforts for underserved communities. The President is also working to send critical funding to states and jurisdictions to support this life-saving work. In the fiscal year 2022 budget request, President Biden calls for significant investments in drug supply reduction, as well as substance use prevention, harm reduction, treatment, and recovery supports. So now we know that production of methamphetamine has largely moved to Mexico, and we are seizing record amounts at the southwest border. The administration is working closely with Mexico on several cross-border issues. This includes efforts to stem the production of methamphetamine and illicitly manufactured fentanyl in Mexico to keep it from ever reaching the border. Also, Colombia continues to produce the majority of cocaine headed to the United States. So we're working closely with the Colombian government. Just a few weeks ago, we agreed to a broad, comprehensive approach that includes collective efforts to strengthen rural security and development, protect the environment, and ultimately reduce the conditions that lead to cocaine production and cocaine trafficking. Finally, in the coming weeks, ONDCT will release additional information on the administration's plans to address methamphetamine supply, use, and consequences in the United States. This plan will reflect a whole-of-government approach that calls for increased engagement with our foreign partners, coordination among law enforcement, and improving access to evidence-based prevention and treatment for psychostimulants. This plan will include actions to reduce methamphetamine use and its consequences through increased engagement with supply countries, coordinating with domestic law enforcement, and all of this will be backed by science and evidence. I look forward to sharing this report with you and the NGA shortly, and continuing the dialogue with all of you about how your state or territory can be involved. So addressing stimulant use is a serious challenge and one that's been recognized by your leadership and your presence here. So next, you have to develop or refine your strategy. And the Office of National Drug Control Policy is happy to work with you as you're developing these plans. Please consider us as a resource going forward. So I want to talk about 3 big picture ideas as you're developing your plans that you might think about. Identify the gaps and opportunities in your community, look at the evidence, and evaluate and adjust. So first, what are your community's needs? Where are the gaps? And if you don't have this data, where can you find that data? Are your providers bilingual where necessary? And do they look like the population that you want to serve? So start by figuring out where the gaps and opportunities are. Based on what you learn from community assessment, develop a plan to fill these gaps. Engage academic institutions, use the peer-reviewed literature, learn from documents in the public domain. So in your review of the evidence, make sure that you're bringing your communities along with you. That includes people with lived experience, those in recovery, family who have experienced loss, and others, so they're invested in the success of this effort as you are. And lastly, make sure you're building in a way to evaluate and reassess along the way. Are you reaching the people who are at greatest risk? Who are you leaving out? We have an opportunity and a responsibility to increase the body of work to address stimulant and polysubstance use and develop promising practices that other communities can build on. So as you're developing your plan, there are several actions and policies that we want to talk to you about prioritizing. First, again, evidence-based treatment for stimulant use disorder. This includes contingency management. We know there are no medications, but there is contingency management. I'm sure you're aware of motivational incentives, and research has shown this can lead to better outcomes for people with stimulant use disorder. Contingency management is one of the most tested evidence-based treatments for people who use stimulants, and the body of literature continues to grow and develop in a way so it's applicable to more specific populations. Reducing barriers to this evidence-based treatment will require some legislative and regulatory changes. and also changes relating to reimbursement rates. So these are processes, policies that we're working on, and we look forward to joining with you in this collaboration. So for justice-involved individuals with substance use disorder, we have to prioritize diversion, screening, and treatment in correctional settings, as well as strong recovery supports, because providing evidence-based treatment during incarceration and upon withdrawal can bring rates of overdose down in communities, sustain recovery, and ultimately reduce recidivism. As I mentioned earlier, ONDCP funds the development of model drug policy laws through the Legislative Analysis and Public Policy Association, or LAPA. So they release new reports and recommendations on a regular basis. I encourage you to take a look at their work when identifying opportunities to improve state policies. You know, it's also important as we're doing this work that we look beyond what we typically think of as drug policies. What opportunities exist to look upstream, to make investments to reduce poverty, homelessness, and trauma? All of these are factors that increase the risk of substance use and ultimately substance use disorders. These social conditions and our legal responses to them are areas that call out for evaluation and policy change to reduce stimulant use and its related consequences. Finally, as I mentioned, I can't emphasize enough the importance of including people with lived experience at the table, share their perspectives to make sure policies address the needs of people who are in or seeking recovery and those experiencing active addiction. The Biden-Harris administration has prioritized this, from the president's cabinet to the Department of Health and Human Services, and here at the Office of National Drug Control Policy. We have people with lived experience throughout our government who are making a great impact on the nation's policies. And at the same time, they reduce the stigma that's too often attached to people with substance use disorder and those in recovery. So we know the importance of funding from the federal government. President Biden has requested $41 billion for the federal drug control budget, and he's proposed increasing the substance abuse prevention and treatment block grant by 84%. That's a total of $3.5 billion annually. And for the first time, the president has called for that block grant to include a 10% set aside to pay for recovery support services. HHS's state opioid response grants, which I know many of you are familiar with, can be used to address stimulant use as well. Our national efforts focus on using public health tools to reduce overdose morbidity and mortality, partnerships with public safety to reduce recidivism, and improve outcomes for justice-involved individuals, and most importantly, rely on evidence and data. Bending the curve in overdose deaths and preventing stimulant use from becoming the next public health epidemic, we know this is an incredible challenge that we face. But I know that efforts that you're doing today will make a difference in this. As President Biden said last week, addiction is personal to millions of families. It's personal to my family, and I know that there's hope. Treatment works. Recovery is possible. And my administration is here to support every person and every family on their journey to recovery. So thank you again for your commitment to this effort. I look forward to working together and making a difference on this issue and a healthier tomorrow for our nation.